close this curtain real quick.
Okay.
Hi, my name's Karina. I'm going to be your nurse today. We're going to be doing a head-to-toe assessment on you today. It should take about 20 minutes if that's okay.
Yes, ma'am.
Alright, we're just going to perform some hand hygiene real quick. And we're going to start off doing the head. We're going to start off with the head. I'm just going to ask you to, can you lower your head for me? We're just going to look real quick. And then I'm just going to palpate your head, okay?
Okay.
Let me know if you feel any tenderness, okay?
Okay.
Okay, and now we're just gonna inspect your face. Can I ask you to pull your hair back for me? Just thank you, sorry. Alright, just gonna inspect, and then we're gonna palpate. Do the facial stuff now. Can I ask you to raise your eyebrows for me? Awesome. Can I ask you to puff your cheeks up for me? I'm going to touch them and don't let me take the air out. Alright, can I ask you to squint your eyes real tight? I'm going to try to open them. Don't let me. Okay, awesome. And then I'm going to ask you to close your eyes and let me know when you feel this cotton ball on you, okay?
Okay. I feel it. Feel it. Feel it.
Okay, awesome. And then I'm just gonna ask you to open your mouth, your jaw up and down and side to side, okay? Awesome. Okay, and then we did the head, we did the face, we did the eyes. Okay, now we're gonna start with your eyes, okay? Alright. I'm just gonna ask you to close your eyes one more time for me. We're just gonna palpate the eyes. Alright. And then I'm just gonna open your eyes if you'll open them. And then I'm gonna open them and if you'll just look up and down for me, okay? Can you look down and then up? Awesome. Okay. If you'll just look at my pen and follow it with your eyes, please. Alright, and then I'm going to ask you to look at my pen and then look over my shoulder, look back at my pen, and look over this shoulder, and then back at my pen. Awesome. Okay, and then I'm just going to ask you to look forward for me, okay? Awesome. And then I'm just going to ask you to cover, or I'm going to cover your eyes if you'll just look straight forward for me, please. Awesome. Awesome. Okay. And then just let me know when you can see my hands, okay?
Okay. I can see them. I can see them.
One more time. Thank you. Okay.
You're welcome.
And now we are going to do your ears. Okay, can I ask you to pull your hair back one more time? I'm just going to look at them real quick. Awesome, and then I'm just going to palpate. Alright, and then I'm going to look in your ears now. I'm just gonna put this in your head, and then I just want you to let me know if you can feel them both, okay?
Okay. I can feel all this.
Okay, awesome. And then we're gonna start with this here. Just gonna pull this hair back. Let me know when you can know where to feel it.
Can't feel it. Can't hear it.
Alright.
Can't feel it. Can't hear it.
Alrighty, awesome. And then I'm just gonna ask you to cover your left ear for me. Alright, and I'm gonna say a word and I just want you to repeat it, okay?
Quarter.
Awesome.
Penny.
Okay, awesome. So that was all we did in your ear. Now we're gonna move on to your nose. Give me 1 second. Okay, and then we're just gonna start off with your nose real quick. I'm just gonna palpate it, okay? Or I'm just gonna look first, and I'm gonna palpate it. Alright. And then I'm gonna ask you to cover one of your nostrils for me and breathe in, and then the other. Alright, and then I'm just gonna ask you to cover your eyes for me. Close your eyes, and then cover one side of your nostril, or one nostril. Let me know if you can smell something.
A Sharpie.
Awesome. And then the other side. Thank you. Alright, and then can you lean back for me and let me look inside your nose real quick? Awesome. Awesome. Alright, and then we are gonna move on to your mouth. And I'm just gonna ask you to smile for me. And then open your mouth, move your tongue side to side. Awesome. And then awesome. Let me look in there real quick just with the timeline. Awesome. And then we just have to check your gag reflex real quick. Alright, this might feel a little uncomfortable, okay? Awesome. Alright, and now we did your eyes, ears, mouth, and now we're gonna move on to your neck. Okay. I'm just gonna start off by looking, making sure we don't have any bumps or anything, and then I'm just gonna palpate, okay? Cardio. And I'm just gonna start by looking at your chest real quick if you don't mind. Awesome. Alright. And then I'm just gonna feel your pulses, okay? Good pulse. Oh, it's pulsing. And then can I ask you to take your arms out for me? Just relax them right there. Awesome. Awesome. Alright, and then can you uncross your legs for me? Can you come a little bit closer to the edge for me? I'm sorry. Awesome. And then could you take your socks off for me? I just gotta feel your pulses down there. Alright. Oh, I can feel those. Those feel good. Awesome. Alright. And now I'm just going to listen, okay? Alright, and then I'm just going to do it the opposite side now. Awesome. Your pulses, or your heart sounds awesome.
Thank you.
Alright, and now we are going to move on to respiratory. No, we're not. I'm just kidding. We're gonna look at your jugular vein. If I could ask you to lean back for me, please. Oh, right there. That's fine. Hold your weight, okay? And then I'm just gonna take a look. I got it for you. Awesome. And just hold on for a second, okay? Alright. And if you look the other way for me. Awesome. Alrighty. Now we're gonna move on to respiratory. Sorry. You're fine. I'm just gonna look at your breathing for a second. Awesome. I'm just looking to make sure your chest is rising. Alright, and now I'm just gonna palpate. Make sure everything's okay. I'm gonna ask you to take in a deep breath, okay? One more for me, please. Awesome. Okay, and now I'm going to percuss, okay? I can get you. Awesome. And then when I touch you, can you just say 99 for me?
99, 99, 99, 99, 99.
All right, and then I'm just gonna listen, okay? I'm gonna ask you to breathe through your mouth, and if you start feeling dizziness, just let me know, okay? Awesome. And then we're just gonna do the same thing to the back side. So if you'll just come on that side for me. Come on this side. We're just gonna feel real quick. Make sure there's nothing. And then I'm gonna ask you to take a deep breath for me. Awesome. One more. Awesome. And then I'm just gonna press. Alright, and then when I touch you, can you just say 99 for me?
99, 99, 99, 99, 99.
Alright. And then just breathe in through your mouth one more time for me. So now I'm just going to we're gonna move on to the nervous system, and I'm just gonna ask you to touch the tip of your fingers with your thumb as fast as you can. Okay, awesome. And then I'm gonna ask you to touch your nose with your pointer finger and then touch my finger. And then do it with your other hand. Awesome. And then I'm going to ask you to put your hands on your thigh and yeah. Awesome. That's good. And then I'm just going to palpate your muscles, okay? Nice and toned. Thank you. Alright. And then I'm just going to ask you to pull against me, okay? So if you'll push against, and then if we'll do your arms, push against, and then do your legs, push against, and then your feet, push against. Awesome. Alrighty, and then I'm going to ask you to muscles. We are going to ask you to move your head around for me. Just rotate it for me. We're checking that range of motion, and then your arms, if you'll just move those around for me. Let me know if you feel any pain or anything. Alrighty, and then if you'll do your wrists, move those around for me. And then I'm going to ask you to put your wrist down, hyperextend your wrist, and then your fingers, I'm going to ask you to expand it. I'm going to try to close them, but don't let me close them, okay? Awesome. And then will you squeeze my hand as tight as possible? Awesome, awesome, awesome. And then I'm actually going to ask you to lean back all the way. We're just going to check your legs.
That should be fine.
We'll see if we can do that.
This is hard.
Okay, well, actually no. Oh, there it goes. There it goes. Okay. So I'm gonna ask you to move your, if you can put the back of your foot up your shin for me. Awesome. And then bring this leg all the way up for me. All right. And then bring it back down and then fold it inwards. Push it out that way and then inwards and then back down. And do the same thing with your other foot for me. Up, outwards, inwards. And then if you'll actually, once you bring this foot down, if you'll take it outwards and bring it back in, and this one as well. Awesome. And then if I can ask you to flip over for me and hyperextend your legs. Awesome. And then the other one. Thank you so much. Alrighty. And then I'm going to ask you to put your shoes on, and I just need you to do some walking for me, please. Let's move this. All right. I'm going to ask you to walk to me. Just walk. All right, and then when you turn that way, I want you to walk on your tippy toes, please. Awesome. And then can you walk heel to toe for me? Awesome. And then can you just stand there for me? Can you close your eyes and just stand there? Awesome. Can you lift one of your legs? Awesome. Can you hop on that one? And then vice versa. Hop. Okay, awesome. And then can I get you to turn around for me? And then if you could just bend over. Awesome. And then if you could come back up. And then can I get you to stand on your tippy toes? And then on your heel. And then can you invert, exvert, and then point them outwards and then inwards. Alrighty, awesome. And now, can I get you to just go like this? We're just checking your range of motion. Awesome, awesome, awesome. And then can you move your ankles around for me? Awesome. Other ankle. Awesome. Now can you just have a seat for me again? All right, and then I just need you to lay back all the way for me, please. Actually, can you stand right back up, or just stay right there? You know, I just need to do your reflexes really quickly. Okay, so we're gonna start here. We're just gonna, and then we're gonna do this one. We're gonna support your arm. Awesome. And then we're going to do this one. Awesome. And then we're going to do your knee. Alright. That's right. You okay? Alright, and then can I get you to take your socks off for me? Alright, we're going to do your back one. Awesome, and then can you put your foot up for me? I'm sorry, we're just checking your mobility. Ooh.
tickles. I'm sorry.
No, you're fine. I understand. It's normal. Then we're gonna do this side. Oh, it's right here. There we go. We got it there. Alrighty, and then we're gonna do this back one. Nope. Okay, and then we're gonna do. It might feel a little ticklish, okay? Alrighty, good job. And then I'm just gonna come and do this side as well with the reflexes. Okay. Awesome. Okay. Now I'm gonna get you to lie down for me. Okay. So we're just gonna start off inspecting the abdomen. Alright. And then I'm gonna then I'm just gonna listen, okay? Just gonna lower this a little bit. Oh, we got some movement. And then we're gonna listen to the arteries. Alright. We're gonna light palpate. Let me know if you feel any pain, okay? Palpate your bladder. Then we're gonna deep palpate. And then I'm gonna ask you to breathe in for me. Breathe out. Alright. And then we're gonna go to the other side. Breathe in for me. Breathe out. Awesome. And then I'm gonna go ahead and put us on this side. Awesome. Then we'll do the other side. Awesome. And then I'm just gonna ask you to sit up for me. And I just gotta. Alright. Awesome. Awesome. Alrighty. I think that's everything. Thank you for your time, and yeah.
Thank you.